I'm Morgan Knull with Feed Your Genes, and today I'm here with Dr. Penny Kendall-Reed. Dr. Penny, could you get us started by introducing yourself to us and telling us a little bit about your practice?
Absolutely. My name is Dr. Penny Kendall-Reed, and I'm a naturopathic doctor in Toronto, Ontario, other side of the country to you. And my specialty is in the neuroendocrine metabolic area, certainly as it pertains to genetics. Genetics is something I incorporate into almost every patient that I see, because truly we are an expression of our genes.
Absolutely. So this is a time where we need to keep our immune system strong. We know that too much sugar is going to weaken the immune system, cause inflammation, and we know we also need protein to strengthen the body. But is there such a thing as too much protein, or can you overdo this?
Really great point. That old saying, we are what we eat, certainly holds a lot of credence. We all know that we should drop sugar in our diet, but really, why should we be doing that, particularly right now? Sugar makes our white blood cells essentially go into a coma. There was a really great study where they took blood from patients and they put the blood into petri dishes and they fed those patients a bunch of sugar. Then they took their blood again, put them in a different set of petri dishes. Then they added bacteria into the petri dishes and they watched how the white blood cells started to attack the bacteria. And what they saw was after the addition of sugar in those patients, the white blood cells, rather than ferociously attacking the bacteria, they just kind of sat back, laid back, and were floating around almost as if they were in a coma. High sugar diets also will drop our innate immune response, which is our first line of defense in terms of fighting a virus or a bacteria. And sugar also increases the release of our stress hormones, which increases inflammation by up to 76%, allowing those viruses to stick onto our weakened, inflamed tissue. So it's really important we drop it. By how much? Genetics, again, shows us who needs to pull the reins in a little bit tighter and who can get away with more. The three genes TCF7L2, GIPR, and IRS1, they will tell us how much insulin do you make to carbohydrates, how much inflammation do you make to carbohydrates, what's your cellular turnover after ingesting carbohydrates. All of these truly dictate exactly how much we need. Protein, on the opposite end of the spectrum, well, we all know that protein increases our immune response. It makes our tissues strong. It's how we make an antibody. But our genetics, particularly FTO, dictates exactly how much we need per meal. And if any of us start to increase protein too much, we really increase the inflammation in our body.
Mhm.
So by using our genes and looking at it, we can really determine what is the exact amount of protein to fight these viruses and who needs to pull the reins in a little bit tighter when it comes to carbohydrates.
Absolutely. And, from learning from you over the years, changing the protein has been one of the biggest game changers in my health. That's for sure. So with all this extra time at home, are there certain recommendations that you're giving to your patients and colleagues to help boost their immunity?
For sure. So we're all stuck at home right now, and the first thing we want to do, sleep. Sleep for sure. It's where our immune system heals. It's where we make an antibody to help fight infections. But some things that we can do along with that, olive leaf extract, a really well-kept secret. It's an antioxidant to boost glutathione, which is a major anti-inflammatory, particularly for the lungs and the bronchi and the throat. But it also is a strong antiviral. It actually inhibits the replication of viruses in us, particularly because it has an adenosine nucleotide, which will block the same type of receptor, the respiratory syncytial receptor, that COVID virus will bind into. So it has a really powerful effect. We can also take oral glutathione as well to get that major anti-inflammatory effect. And then laughing. We know that cortisol increases inflammation. Getting rid of cortisol or laughing helps to decrease it, and that's going to decrease our inflammation too.
Or if you're in my household, taking a few capsules of Serenitin Plus always helps too.
I'll admit I'm living on that one too.
So when you're helping a patient who wants to boost their immune function, what genes specifically are you looking for? And once you find those genes, how is that changing or dictating your protocol that you'll use?
There's three main genes that I'm looking at right now with patients. The first one is called IRF1, and it's part of the interferon regulatory family of immune substrates. And what it does is it controls the transcription and thus the replication of the virus. So those people who are variant or don't code very well for it, basically their body can't see the virus very quickly. So the virus comes into the body, starts replicating, starts producing symptoms, and then the immune system goes, oh, I got to start attacking it. But by that time, the viral load is so high in the body that we're actually not only far more symptomatic, but we're also far more contagious. I'm also looking at HLA-DQB1, and this is part of the major histocompatibility complex set of genes. And this provides instructions for proteins that are on the surface of immune cells and thus triggering the immune response. But here's the opposite end of the spectrum. Here, being variant has an overproduction within the immune system, so increases too much inflammation, has an exaggerated response, like what we see in asthma and allergies. And this gene is really prominent in our lungs again, the area that COVID is really attacking. And the last one is IL-6, or interleukin-6. And this is the production of one of our major inflammatory cytokines or substrates in the body. And it gets triggered by a multitude of things, but infection being a big one. Here, if you're variant, for the same virus or the same infection, you make a great deal more inflammation, which then means, once again, that virus can take hold and start replicating much faster. So these give us an idea of how we need to target our treatment a little bit more and who needs a little bit extra support again.
Absolutely. That's really great insight. And as usual, super informative, impactful few minutes with you today. You and I have committed to releasing a few short videos like this in the weeks to come. And so if anyone has specific questions for us, I encourage you to put it in the comments. We will also be hosting our first of our webinar series on April 3rd. And if you're not registered, you can email us at info@feedyourgenes.ca. And Penny, thank you again so much.
Thank you for having me. It's fun to be here.